Well, you're doing great.
Thank you.
I'm very pleased to see your progress, and you have gotten yourself down to a BMI that is about as healthy, certainly as healthy as I've ever seen you. And you are now in a category that nobody can call you obese, which is really kind of cool.
What?
That's really cool.
I lose the O?
You lose the
Because
ego.
you know what? There's just nothing more offensive than going to a doctor and the doctor telling you you're obese. It just stinks.
You're just a few pounds from being, no longer categorized as overweight. You're very close to what would be considered a healthy BMI, which is excellent. But the real question is, how are you doing?
I feel great. But the word I am waiting to hear from you is remission.
Well, let me ask you, how are your blood sugars running?
Good.
When you check them, they're not elevated, is that correct?
They're 90s.
Have you had another hemoglobin A1C drawn yet?
No.
You should do that, just because that gives us a big picture, and your family doctor will be, doing this. But that'll give us sort of a big picture overview of what your blood sugars are running, not just at the instant that you check it, but over the period of days, weeks, and that's what really tells us how well you're doing. But I'll bet you that it'll confirm that your blood glucose problems are under control. Let's put it this way: you're not taking any medications for your blood sugars, right?
No.
And your blood sugars are not going up. And
Right.
if your hemoglobin A1C is within normal range, what does that mean to you? It means you don't have any symptoms at all from diabetes, which is what I consider to be remission.
And my story isn't a special story. My story is the norm, right?
It's pretty typical, yes. And everybody who has type 2 diabetes or adult onset diabetes, we see either resolution or remission or at least dramatic improvement. And so your story is very, very typical.
Okay. One more question for you, because I know other patients are calling you. I can't monopolize all your time. But what about for the people who have the sleep apnea story and the high blood pressure story? Are they seeing the same kind of results that I'm seeing?
Yes. Anytime a person has a health problem that is related to obesity, you get the obesity under control, the health problem gets better. I'll see you in a few months, see how things are going.
Okay. But right now, what's the prognosis?
Excellent. You're doing well. And from what you've described to me in terms of the types of food choices you're making, I think if you keep that up, you're going to get good weight loss results. You're going to get down to a weight that's much healthier for you. And more importantly, if you can sustain that, you're going to be able to maintain that weight loss, which is different than anything you've done before, right?
Yeah.
Yeah.
Dr. Cox, thank you so much.
Thank you.
I'm in love with them. Love.